Hi, everyone. Hi, everyone. Thanks so much for joining us today. We are just going to give it another minute for folks to hop on before we start our official webinar. Hang on tight. Thank you. Great. Hi again, everyone. On both our Zoom and Facebook live stream, we are so excited to be in community with you all today. My name is Quinn Din. I am the Executive Director of SEARAC, the Southeast Asia Resource Action Center, and it is with great honor that I welcome you to our webinar today, the State of Southeast Asian Data Equity and Revisions to Statistical Policy Directive number 15, which we'll break down in just a little bit. And if we can go to the next slide. I just want to provide just quick remarks before we open and thank the folks who will be joining us today from our CRAC team. Anna Bion, our Director of National Policy, Kam Moa, our National Deputy Director, Mandy D, our California Deputy Director, as well as partners from AAPI Data with Akil Vora, as well as CACF, a Coalition of Asian American Children and Families with Lloyd Fang. We are so excited to be able to share with the community how this new policy revision is going to impact Southeast Asian American communities and what this means overall for the AAPI community, communities across the country as we begin to embark on a new phase of what data equity looks like in our country. And to start, I'll just share that my pronouns are she and her. Here at SEARAC, we have been huge advocates of data disaggregation to push forward our community's right to be seen. And we certainly recognize that this policy revision is a huge stride in terms of racial and social justice. For the first time, we are able to have community members from the Middle Eastern and North African American communities be identified. And we stand in solidarity with our community partners to recognize this community self-determination and being able to name themselves instead of being named by institutions. We also recognize, as you'll hear later in today's webinar, that this is also a huge victory for the Asian American community, where we'll be getting disaggregated data from federal agencies across this country as the minimum standard, and which this has never happened in the history of America. So this is also a huge victory. And for Southeast Asian American communities, there are some wins, which we'll also hear about. But we are also clear that there are a lot of gaps and challenges as well. And for our communities, we need to make sure that together with folks on the ground, with leaders, students, parents, with our community partners, that we stand with power to really push forward, not just to push forward the requirement that our country not just meet the minimum standards, but really go beyond that. And with that, we really wanted to welcome you all to today's webinar and actually start with a couple quick polls to get a sense of who's joining us today. So shortly, you'll see two questions on your screen. If you can share with us where you're calling from, the Midwest, Northeast, South, or West Coast, and also in what capacity are you joining us today? Perhaps you're an advocate, an individual, media, researcher, or other. We'll give folks just another minute to answer if you can. And we'll go ahead and give folks another 30 seconds before we close out and share with the community. And we'll go ahead and close out and share results. And we'll see that we have representation from every region of our country today, from the Midwest, Northeast, South, and West Coast. We are so delighted and excited that we have national representation across every region in which Southeast Asian Americans call home, as well as allied communities, as I'm sure we also have represented in today's webinar. And it looks like the majority of folks here are advocates. Hopefully the information shared today will help to share with you the analysis that we're seeing at SEARAC, at API Data, at CACF, at the impacts that we're anticipating that this new policy revision will have in our communities and other Asian American communities across the country. Thank you all so much again. To give you a quick sense of who will be joining us, we can go ahead and go to the next slide. I mentioned earlier that we'll be joined by our esteemed speakers, Anna Bion, our National Policy Director, Akil Vora with AAPI Data, National Policy Director, Kamoa, SEARAC's National Deputy Director, Lloyd Feng with CACF, Children and Coalition for Asian American Children and Families in New York, and Mandy D, our California Deputy Director. And if we go to the next slide, we'll go ahead and give you all an overview of the topics that we'll cover today, including the overall revisions, what that looks like, diving deeper on the impact on Southeast Asian communities, some state impacts as a snapshot, so California, New York, and then we'll go into next steps and Q&A. And with that, I want to thank you all so much again for joining us, and I'll transition it to Akil Vora from API Data. Thank you all so much for your incredible partnership in this fight for data equity and visibility. And I'll go ahead and transition it to Akil.
Thank you, Quinn, and thank you, SEARAC, for organizing a very important dialogue and discussion on an issue that really impacts all of our communities. My name is Akil Vora. I'm the Director of Policy at AAPI Data. Our focus at AAPI Data is transforming public and private systems to ensure that Asian American, Native Hawaiian, and Pacific Islander communities are recognized, valued, and prioritized. So I'm excited to talk to you a little bit about the recent changes with Statistical Policy Directive number 15 and a few next steps. Next slide, please. Thank you. So for the first time in almost 30 years, the federal government has made changes to how all federal agencies will collect race and ethnicity data. For the first time, they're making major changes in 5 discrete areas, and we'll walk through each of them. First, they got rid of what we call the combined race and ethnicity question. This question, many of you have filled out any forms, asks first, are you Hispanic or Latino? You check yes or no, and then you check additional boxes that fit your race or ethnicity. Now that is one question instead of 2. Why did they make this change? Many respondents found that the previous question was confusing, it didn't make a lot of sense, and a lot of folks simply did not respond. So they made this change to make it easier for communities to identify their ethnicity or race. The second thing is, Quinn kind of alluded to previously, was adding a new category for race and ethnicity called MENA. These are individuals from Middle Eastern or North African areas. And the reason why this was made was this was a long-term mobilization by people from this community who previously identified as white and raised issues for a number of years about how this group should be distinct, and recognizing specifically issues of discrimination that this community has faced, and in order to be in compliance with civil rights laws, needed to be counted accordingly. Third, an update terminology in SPD 15. And so over time, our sense of how we describe our communities changes. There were quite a few changes related to terminology, but for our communities, a few things to identify is replacing Far East in the definition with Central or East Asian, changing Indian subcontinent to be more inclusive, and changing that to South Asian. Why? We want to be more inclusive. We want language that's clear, and we want to make sure that when people are filling out these forms, they see themselves in these documents and forms and more likely to fill them out. 4 and 5 are critical areas. These are areas where we're asking the community to pay close attention to now and moving forward as we think about implementation. Number 4, federal agencies must collect data beyond the existing 7 categories. What does this mean? It means collecting information about subpopulations like Koreans, Hmong, Vietnamese, Burmese, Indian, Chinese. Why? This was, again, a credit to all of you. Strong push from the community for a number of years, and this will be more reflective of our demographics. So an individual like me, my parents came over by plane from India. Our stories are very distinct from others who may have come to this country by boat and who may be refugees. Those stories and those histories are different, and we need to recognize that in how we collect the data. And the last part is some description about how this is going to take place. In 18 months, all federal agencies must submit an action plan on race and ethnicity, and full compliance must be within 5 years. And the reason why is the federal government is putting some benchmarks for future progress and monitoring. It's important to note that there were recommendations to OMB from federal agencies, and originally the timeline was 12 months for the agency plan and 4 years for full compliance. So we see that the timeline has been extended a bit to give agencies appropriate time. Next slide, please. One thing that's important to realize is not just the Federal Register notice, but there are a number of annexes that are rich with information that provide background on why OMB made this decision. This is important because it provides us insight into telling us what the federal agencies were thinking about potential barriers to completion. And it helps us as community know what support we may be able to provide agencies, the Office of Management and Budget, and where we might be able to hold agencies accountable to get to 100% compliance. Next slide, please. So what does SPD 15 really say? What it says is that they are asking all agencies to ensure that they require detailed categories moving forward. So when a federal agency, this is an illustrative example that was included in the Federal Register notice. So instead of simply marking Asian, you can mark Asian plus checkboxes plus a write-in. Now, again, this is illustrative and it could differ from agencies to agencies, but OMB is asking folks to really utilize this approach moving forward. But if the form has no detailed categories and no write-in field, then it'll be the same form as OMB has utilized previously, which really doesn't make a lot of progress for our community moving forward. So this is the form that we should be pushing for and the one that should be updated. Next slide, please. So there are a few concerns that we have. First, it's not clear where the starting line is. There is no current consolidated list of federal data collection tools, making progress really difficult to monitor. We don't know where we're starting from. What we're asking for is that OMB ask all the federal agencies to provide their censuses, their surveys, all of their programmatic forms, and we consolidate that in one central location so we understand what information is being collected currently on race and ethnicity to measure progress moving forward. And we're asking that that be done within 45 days. This will establish a transparent and public accountability mechanism so the community and the federal government itself can track progress moving forward. Next slide. Here's the concern. While the federal government is requiring all agencies to collect disaggregated data, there's an exception. And that exception says the following: unless an agency determines that the benefit would not justify the burden, right? It's a benefit burden analysis. Or if there is a risk to privacy or confidentiality, then agencies can ask for an exemption to OIRA. And thank you, Quinn. Quinn flagged this issue, and she's absolutely right. What we're asking is that OMB narrowly interpret this exemption and provide guidance to agencies to ensure they're really clearly and narrowly tailoring guidance for these exceptions. We don't want this to be a hall pass for all federal agencies. We want to ensure that federal agencies are being circumspect in their approach, and OMB is being judicious in their acknowledgement and acknowledging how agencies will be working on this information moving forward. Next slide. We also believe that public participation is a key to success. Public participation was a key part in OMB's original thought process in coming out with these decisions. It's talked about in a lot of the implementation materials. It's talked about in the Federal Register notice. Unfortunately, there's not a lot of detail on how the public can get involved. We want to make sure that the community is involved throughout the process in a regular format, both with the Office of Management and Budget and with each of the all the federal agencies. So our recommendation is to ensure that OMB provides clear guidance, ensure that there is a forum with the Interagency Committee on Race and Ethnicity Standards. So what is that? That is a new group that OMB is putting forward that will include representatives from major federal agencies that will start looking at research and issues that affect all communities for its next decision-making. We think this would be a good forum to allow the public to provide comments. We definitely need a framework, we need tools, and we need a timeline. Beyond the 18 months, we need to see regular steps so we can ensure that the work is getting done. And lastly, as I mentioned before, we really want to make sure the community feedback is incorporated into agency action plans that will be made public after the 18-month period. Next slide, please. Again, to boot, I think in all our 3 strong recommendations at the outset of this announcement are the following. The chief statistician, who's responsible for all data and data collection within the federal government, must provide an inventory of all federal agency data that's collected and to let us know which tools are being disaggregated and which are not. Secondly, we need to name an implementation body. The Interagency Working Group is primarily for research. Which entity within OMB is going to be responsible at the end of the day for implementation, and to make sure that those guardrails around exemptions are narrowly tailored. Third, ensure that the federal agencies provide formal and regular role for the community input and expertise moving forward. Just wanted to provide our email address for folks. Next slide. That if you have any additional questions on this issue, please email action@aapidata.com for questions and feedback. Thanks, Quinn. I'll hand it back to you.
Awesome. Thanks so much, Akil, for that really super high-level analysis and also the recommendation to really democratize this process to make sure that our community's power pushes through to see equitable implementation. And we'll, from that big picture analysis, we'll shift to Com to share a little bit more, drilling deeper on the impact of Southeast Asian Americans.
Thanks, Quinn. Hi, everyone. At SEARAC, we've been working on this issue for over 20 years now, SPD 15, while it's a huge step forward for our communities, has a number of gaps related to Southeast Asian Americans. While we can also still claim a number of wins, there's quite a few things that we have to continue to work on. So, as folks here probably know, Southeast Asian refugee communities have a fundamentally different experience from geographic Southeast Asians and from the broader Asian American diaspora. Our experiences are colored by our lives and our experiences as refugees. And that's part of the reason why data matters so much for Southeast Asian populations, because when we look at it, we know that our populations still have some of the highest disparities within the Asian American diaspora. This is data that we pulled from AAPI Data, is one of the more recent report. Thanks, Akio. If you take a look at it, you'll see that Southeast Asian Americans still have some of the lowest rates of educational attainment amongst all Asian American populations. This doesn't even capture the full extent. Recently, states like Minnesota have disaggregated student data, and we know that in 2012, Southeast Asian students had some of the lowest rates in reading, math, and science amongst all K-12 students, for example. You'll also see that Southeast Asians generally have a higher rate of limited English proficiency. We also generally have higher rates of poverty and higher rates of usage of federal programs like SNAP. One of the important things to keep in mind about SPD 15 is that, there are some major victories for us. For the first time within the broad 6 Asian American categories that they're required to collect data on, Vietnamese is one of them. In the another group category, Hmong is also listed as an explicit example group, along with Pakistani and Afghani. Those are, victories that we can claim about, what we've done, and it helps increase the visibility for our communities. That said, the minimum standard that the revisions have put together include a whenever possible clause. Essentially, it's both mandatory and discretionary. And the minimum Asian American categories that they have to collect data are Asian Indians, Chinese, Filipino, Japanese, Korean, Vietnamese, and another group, with in parentheses Pakistani, Hmong, and Afghani as examples. This is in a checkbox format. And this creates a significant barrier for us, because while it is mandatory that they replace the another group checkbox with a write-in example, as seen in figure 1 on this slide, it does not, it only happens when it is possible. So in all other instances, they do not have to use a write-in option, and it can instead use a checkbox. And what that means is that the data that they're collecting on all other Asian American groups are essentially not disaggregated. It's hard for us to actually differentiate between the populations, and the information becomes muddled for non-Vietnamese Southeast Asian populations. So if you take a look at this, Akio had already sort of mentioned it already, but figure 1 is whenever possible is an example of what agencies should do whenever possible, and that is to replace another group with the write-in option. And then having a write-in option does a lot of things for our communities, because 1, it allows us to write in our categories, our ethnic identities, and it also allows them to collect that data in the same way that the Census Bureau does for the American Community Survey or for the 2020-2030 census. Figures 2 and 3 are what the opt-out results could look like. So if you take a look at it, it essentially are just aggregated Asian American categories for figure 2 with examples of the 6 big populations. And then figure 3 doesn't even include examples. Ideally, for SEARAC and for Southeast Asian American populations, we want to make sure that the federal standard is that federal agencies use figure 1. That way we can collect data on our communities and make sure that Hmong, Laotian, Cambodian, Mien, Montagnard, and other Southeast Asian communities can have our data captured. In addition to that, some of the things that we're also looking at include making sure that the example categories aren't just limited to Hmong for Southeast Asian populations, but we are able to work with agencies to include expanded example groups, including Cambodian, Laotian, Mien, Montagnards, and so on. So, that's the impact on Southeast Asia in a nutshell. There's a lot more, certainly, but, the minimum important thing for us to understand as a community is that we need to fight for a write-in option. That needs to be the minimum standard, not a checkbox for another group, because it doesn't allow us to collect the information that we need.
Terrific. Thank you so much, Kam. One of the big questions we've been getting also is how does this federal policy impact state policy? And for that, we'll have two examples, starting with California, where we'll have Mandy D share a little bit more about AB 1726, our landmark data disag bill that was passed, and share a little bit more analysis on what we're seeing.
Thank you, Quinn. Hi, everyone. So I'll preface by saying that while we're focusing on the effects on Southeast Asian American communities and the Asian American categories at large today, I do want to start by uplifting our California partners and Native Hawaiian and Pacific Islander serving orgs who did a really thoughtful webinar on the effects of the revisions on NHPI communities yesterday. So we'll go ahead and drop that in the chat for folks. And then we'll get started with the next slide, please. Thank you. So within the California context, California was actually one of the few states that required disaggregated data by race and ethnicity beyond what the federal standards were showing for Asian American and Native Hawaiian and Pacific Islander categories. And within the Asian American category scope, that is still true today, even with the new SBD 15 revisions. So in 2012, California was actually already requiring all agencies in the state to disaggregate demographic data for Asian American groups, which you can see listed out in the left side column. And then this alone you can see is already beyond what the new SBD 15 categories require. And then 10 years later in 2022, another California law went into effect requiring even further disaggregation and the inclusion of additional Asian American groups, which are in addition to the list you see on the left side, so combined with the right side as well. And the second law was specifically focused on the California Department of Public Health. And this law came from the result of state legislation that SEARAC co-sponsored and helped pass, also known as Assembly Bill or AB 1726. And this bill itself names specific health indicators to disaggregate for Asian American groups listed here, including birth and death rates and other indicators like major disease rates. Next slide, please. So with the law in effect in 2022, SEARAC has been meeting with the California Department of Public Health, as well as a lot of data advocates to monitor and ensure proper implementation of the bill. And throughout this process, we also met with several local health departments in California to understand the challenges to meaningful data collection and reporting and to ensure that the law was actually being implemented to its intention when we passed it. So what we actually did was publish a findings brief on what we learned last month, which we'll also drop in the chat. And it highlights root issues to data equity at the agency level, as well as recommendations on how agencies can better engage with community and researchers and other folks to ensure better data practices. And so to summarize some of the key challenges that we saw and are written in the report is one, we saw that data practices actually needed a lot more standardization and coordination across all stakeholder levels. So SBD 15 and the 1726 bill are just two among many other data rules and tools that agencies find really difficult to reconcile. So most of the folks that we talked to actually just did the bare minimum per federal standards, and many, knowing that the revisions were coming, sought to wait for the revisions for guidance rather than take initiative to start implementing more data segregation. And then another issue under that we found was it really was unclear who within the department or which groups under the agencies were responsible for doing the implementation. The second key issue that we saw was that data systems and staff needed a lot more investment and integration. There were a broad range of systems that were being used to collect health data. And we learned that for different indicators and health data, different systems may have different abilities and technology needs to actually collect adequate race and ethnicity data, regardless of the laws and the regulations. And a lot of that was also tied to what folks had mentioned as a key issue for not collecting data, which was technical data limitations, such as privacy concerns for gathering information on smaller groups. And that was one of the key excuses we heard repeatedly from agency folks for not being able to collect disaggregated data for Asian Americans and Pacific Islanders. And then lastly, the third key finding that we found was that the issue of data equity needs to be seen as a crucial public health tool and also as an equity and racial justice piece for folks within agencies. And so the agency staff that, and often leadership that we spoke with, there were quite a few folks who really wanted to be more involved in the data equity movement and within their agencies, but it was shared that there was definitely a lot of additional training and understanding that was required for folks within the agency to understand why data equity is important. And what we heard was from their perspectives that improving public health interventions, as well as improving cost effectiveness of government funding, or some of the key drivers that motivated folks to invest in data equity. And so as advocates, we need to continue highlighting success stories of how data helps us improve accuracy and also reduce disparities and ensure cost-effective application of government funding. Next slide, please. So lastly, how do the SBD 15 revisions affect California? So as you can see, while California while being way ahead of the curve in terms of actual data disaggregation rules, we're still trying to figure out how to actually implement these laws at state and local levels to actually do what the data is intended for, which is to inform resources and address inequities in resources to the community. And so overall, with the revisions, the Southeast Asian American categories are still much stronger across California agencies, especially for the Department of Public Health. But we do know that with many public health data sets, a lot of those are actually being collected and implemented through trickle-down federal funding. So for groups or folks who are responsible for public health data that are not compliant yet with more robust data disaggregation laws, they will be expected to at least meet the revised SBD 15 standards at a minimum. But currently, advocacy groups, including SEARAC and many folks here on this webinar, are pushing for alignment with stronger state laws. And some agency data is already being shared that are in alignment to some of the stronger California laws and definitely beyond federal standards. So as you can see, overall, all of these rules and technicalities alone can create a lot of confusion as to what agencies have to follow. And so federal rules should actually be the gold standard and much more clear and robust on what we should see for agencies to follow and use as guidance. And then as mentioned already, the option to essentially opt out is a huge concern. And because of what we heard with the data challenges at the state level, we think that the creation of a technical working group is a step in the right direction. But even with 1726 as a case example, in 2022, during the year of implementation, CDPH actually released a data brief that cited a long list of data limitations for delays and poor implementation of our bill. But working with data specialists and data advocates inside and outside agencies, we know that actually a lot of the excuses and the data issues can be addressed. And so in kicking off a new data equity work group with the California Department of Public Health, CBOs like us are advocating strongly for research and data scientists to be in the space and actively collaborate with the community and community leaders to address technical issues. So while the revisions don't actually state this explicitly, it is really important that the best practices that are developed to address technical issues and the tools are shared downstream to state and local agencies, and that agency staff are properly trained to understand it and address them. And then to Akio's recommendation earlier, we really believe that agencies need to submit stronger justifications and demonstrate that they did their due diligence before being able to opt out of these requirements. But unfortunately, the language in the revisions is vague and continues to set a bad precedence for agencies to do less, which we have seen. So in summary, with the law, California as a state still goes above and beyond federal standards. And there is political will and a lot of advocates in the space that are pushing this work forward. And we are making progress, especially on our law within the Department of Public Health. But a lot of the complicated issues noted in the brief and discussed here today, including poor accountability and data challenges, need to be addressed on a much larger and much more cohesive effort. Thank you.
Awesome. Thanks so much, Mandy. And something Mandy didn't share is that one of the other best practices in California is that SEARAC, as well as our partner EPIC, Empowering Pacific Islander Communities, are actually co-chairs of a work group to implement AB 7226 with the California Department of Public Health. And that model of collaboration, not just consultation, is one that we're really hoping to be able to scale up and see replicated at the national level, which is why understanding state policy impacts is so important. Thank you so much, Mandy. And shifting coasts, we're going to go to New York with Lloyd with CACF to share a little bit more about their huge victory with their data disag bill that was just passed and what they're seeing in terms of the impact that this new revision has in New York.
Hi, everybody. Thank you so much, Quinn and SEARAC, for having us here today. So the Coalition for Asian American Children and Families is just under 100 Asian-serving member organizations that serve, South Asian, Southeast Asian, East Asian, Central Asian, and Middle Eastern North African New Yorkers in terms of various direct service needs. But we're also a policy shop focused on equity and opportunity. And included in that is our Invisible No More campaign that has been our longstanding, over a decade and counting campaign advocating for AA and NHPI data equity in New York City and New York State. So next slide. So as Quinn mentioned, right, we did get this historic win back in 2021 when New York State Governor Kathy Hochul signed New York State's first ever data disaggregation law. This law mandated that all state agencies that directly collect demographic information on ancestry or ethnic origin would now have to collect such data on the 10 most populous Asian groups, as well as the 3 most populous NHPI groups. And so I'll go into that in a bit, but it also includes language spoken at home. Next slide. And so in terms of some of the reporting requirements, agencies are required to report such disaggregated ethnicity data on groups that are no longer in the top 10 most populous groups until the release of the next 5-year ACS. I also wanted to draw your attention to the fact that most of these agencies, right, were supposed to have produced such disaggregated ethnicity data and published them to the public starting in December 1st of 2023, with the exception of a few agencies that have a deadline of July 1st, 2024. And there's also an opt-out option, right, where agencies can sort of indicate that they, for privacy reasons or whatever limitations, can't produce such data on our communities. Next slide. I also wanted to share another historic win of ours. In 2016, CACF, together with advocates in the LGBTQIA+ communities, we advocated strongly for New York City's first ever demographic data laws that mandated that 7 city agencies would have to start using this voluntary form consisting of demographic questions on race and ethnicity or ancestry, multiracial identity, and sexual orientation and gender identity. For the ancestry question, they stipulate that it's the top 30 ancestry groups and languages spoken that the survey would have to have categories for. And in a nutshell, I just wanted to share this. It hasn't been working that great for us, which is part of the reason why we went to the state level to get the state bill that became law. Next slide. So in terms of what's been going on with some of the implementation efforts that CACF has really been leading since we got these laws, well, currently, in regards to the state law, we haven't seen any state agency, office, board, or commission publish a report with demographic data that includes the disaggregated ethnicity data for the 10 most populous Asian groups and the 3 most populous NHPI groups. And part of this, we've seen from our engagement with agencies is that Some of them just don't really know that this law is on the books, which means that there isn't a lot of oversight that is being prioritized for this law from legislators or from the executive chamber themselves. So that is really a real shame for our communities. But we also wanted to draw your attention to some of the work that CACF has been doing. We know that agencies, we want to help them. We want to make sure that we can collaborate them and give them information that would be helpful in making the implementation process as smooth as possible. So we have been working on implementation guides focused on data disaggregation by ethnicity. So in 2023, we released, together with our partners at the Center for the Study of Asian American Health, this manual on collection, analysis, and reporting of Asian American health data that actually also includes recommendations for Black data disaggregation, white data disaggregation, MENA data disaggregation, American Indian, Alaska Native data disaggregation, Hispanic Latino as well, and NHPI. But we're also in May going to release this blueprint guide focused on the education department in New York State. Also, in New York State, we have longstanding reappropriations that we secured starting in 2021 for agencies to figure out how to do implementation. So this, concern about agencies not having the right budget, we don't think that's a very good reason, right? It's because the funding is in the millions of dollars, and it exists, and it's still available for agencies to take advantage of. Finally, we've engaged the New York State Comptroller's Office to be a force of accountability for the implementation of this New York State law. Next slide, please. So how does the updated SPD 15 impact New York State Asian American and Native Hawaiian Pacific Islander data disaggregation? So talking about Asian Americans first, right? You'll see this chart on the left-hand side. These are the groups that are covered under the New York State law. It's the 10 most populous Asian groups. It's from Chinese all the way down to Taiwanese, you'll see. SPD 15 actually, doesn't include, the New York State law definitely goes beyond SPD 15. It's really, New York State's law is a bit better in that regard, but there are still a lot of limitations to what the New York State law provides for groups that most need to be captured in government data collection, right? The groups that are smallest in number. And then we also wanted to make known that the New York City law includes some groups with diasporic Asian populations that oftentimes aren't coded as Asian, like Guyanese, Trinidadian, Tobagan, and Jamaican. Some other concerns include that New York State agencies won't act until they see the federal folks acting, right? So we really want to make sure that we're engaged, with API data, with SEARAC and other advocates to make sure that the federal side is moving, because state folks oftentimes just wait to see what federal does first. The same opt-outs that some of the folks mentioned earlier, the New York State law, as I mentioned, also has some opt-outs that we're worried will be exacerbated if there are opt-outs acted upon in SPD 15. And then currently in our communities, there are quite a few groups that are obviously frustrated that there's this perpetual lack of inclusion that SPD 15, even with the revisions, still is perpetuating. Next slide. Oh, great. And then finally, in terms of the NHPI data disaggregation and the impact of SPD 15, I just wanted to show these groups, right? The New York State law and SPD 15 are pretty much in harmony. And then it's just if the SPD 15 categories that go beyond, some of them do go beyond the New York State law, which is great. But we want to make sure that New York State agencies will actually act in partnership with federal or before federal. So I'm going to stop there and pass it back to you, Quinn.
Awesome. Thanks so much, Lloyd. I think the big question that we have is what happens next. Mandy and Lloyd both raised a lot of concerns that have also been raised about the national landscape and what happens when folks opt out or trying to fight back against that as much as possible. So I'll transition to Anna and Akhil to share with us what's going to happen now.
Great, thanks, Quinn. And a huge thanks to all of our colleagues who are joined us today as panelists, as well as to everyone in the audience who has joined SEARAC, AAPI Data and CACF for this webinar today. So I'm sure you're wondering, at the top of the webinar, we did a quick poll, and it seems like many of you are advocates, and I'm sure you're wondering what happens next. While the new regulation included some goalposts for implementation, like a timeline, it's really important that we remain vigilant about how agencies implement the new standards. And as Akhil previously discussed, there are still some details that can absolutely be fleshed out better to help agencies implement this new regulation with fidelity. And that's why we ask you as advocates to join us in urging the federal government to publish a complete inventory of data sets that must be disaggregated so that we can track progress, and also to release strict criteria for when an agency can actually opt out of collecting detailed demographic data so that the waiver process can't be misused by agencies. And remember that this will all go down over a span of years. Federal agencies need to have their plans for disaggregating their demographic data finalized within 18 months, and then they have 5 years to actually implement the new regulation. So this is going to be a long haul for us to keep monitoring and engaging with the government as they're working towards implementing the new rules. And as my colleagues have already shared, state and local agencies must also implement the new regulation for, at a basic level for any data collections that are funded by federal funds, but to have consistency across their data, we can expect widespread implementation of the new regulation at the state and local levels as well. And so it's so important that we continue to monitor, engage with these efforts so that all of our communities are seen and served by government institutions. Next slide, please. A few concrete ways you can start to get involved as advocates are as follows. And these are just suggestions that we have for now. And there are so many more advocacy efforts that are starting to roll out across the board. And so this is just a handful of things, and definitely reach out to any of our organizations to learn more about the issue or to get connected with other initiatives as well. But one of the ways that we like to that SEARAC has to suggest is for you to work with your elected officials to keep agencies accountable. You can work with your members of Congress to keep them on track, them as an agencies, on track with implementation by encouraging your member of Congress to do things like sending a letter inquiring about the progress of implementation, or requesting a meeting with agency heads to do the same. Just to give 2 examples, remember that your elected officials are your representatives in government. You can also join the Power in Numbers campaign led by AAPI Data, and I will ask Akhil to share more about this momentarily. Or you can also join SEARAC's Data Disaggregation Working Group, which is an informal kind of space that we convene for organizations and have been convening for years now for organizations and advocates to gather and share information on data disaggregation, advocacy happening within their communities, as well as to provide thought partnership and really brainstorm with each other for their advocacy efforts. Akhil, I'll actually pass the mic to you now really quickly to talk about the Power in Numbers campaign.
Thanks, Anna. Always such smart feedback and thoughts from Anna. I think Anna really hit the nail on the head in terms of actions that individuals can take in order to ensure that the gas pedal is fully pressed on this issue. And I agree with her that this is going to be a long haul. There's a 5-year period. But with many races, I think we want to make sure that we're out front and we're pushing early to ensure that we are not behind the curveball. And we are kind of proud to have working with many different organizations on the Power in Numbers campaign. And what is that? It's basically a national community-led effort, local, state, and national organizations to really push for policy change and investment in civic engagement. There are 3 things that we're focusing on for our communities: to making sure we're recognized, to making sure we're respected, and to make sure we're prioritized. And what does that mean? When we talk about recognition, we want to make sure that folks understand that we need to collect data on our communities. Having data on Asians and having data on Native Hawaiian Pacific Islanders is not enough. And we applaud Census and a number of agencies who are moving forward, and thank OMB, and would like to ensure 100% compliance with all other federal agencies. Respected, we want to make sure that state and federal policymakers are leaning on community expertise, are consulting our community organizations and people, and really ensure transparency in the process moving forward. And lastly, prioritize. We want to make sure that our community has the resources and the commitments to be able to undertake the work to support our populations and make sure that data is published in a timely and accurate manner. Next slide. So we have 3 goals. We're pushing state and federal policymakers to recognize and prioritize our communities with their data and the publications. So thank you to Lloyd at CACF, and thank you for Mandy, who's doing a lot of great work in California on pushing states in this vein. Secondly, we are prioritizing accurate data and community-friendly tools. It may not be helpful if someone sends you a document that's in Excel with data everywhere, and we don't know exactly what this means and how to use it. So we'll take it in that format, but we would also appreciate ways that are translated, there are infographics and other ways that make it accessible. And lastly, we really want to amplify and engage our communities to ensure that they're involved in civic government. Look, we know that capacity is an issue for our organizations. I was an ED of an AA NHP organization. I know how many times people ask for help, but we know that, and we are working to help build capacity for our organizations. This includes communications and policy training moving forward, and we're creating additional data tools. So when you're meeting with legislators, when you're meeting with funders, when you're making an advocacy pitch, we hope that you'll have additional data moving forward. So we hope, next slide, please. So we hope you see your organization here. And if you don't, it should be. So our power really is in numbers. We need folks to rally on this issue. We need to make sure the job gets done. And we hope that we can count on all of you to join power numbers as well. With that, Quinn, I'll pass it back to you.
All right, I think Quinn is still trying to get back on. So thank you, Akio. Thank you, Anna, so much. We'll move into Q&A. So the first question for panelists is, how can we ensure that the revised SPD 15 urgently strengthens the collection, reporting, and community access of this aggregated data? And should agencies seeking exemptions from detailed data collection be required to demonstrate specific burdens or risks? And what alternative data sharing methods should be promoted to protect confidentiality while empowering communities? Akio, I'll turn that question over to you.
Thanks, Com. So there are multiple ways in how folks can get activated in working on this issue. So number one, speaking directly with OMB, the chief statistician at the Office of Management and Budget is the one who principally will be owning this entire project moving forward. We have some questions, but asking OMB and their interagency working group questions about clarity and transparency, I think, is the first level. Secondly, working with individual agencies directly, whether your focus is education or environment or outer space, whether that be NASA, whether it's HHS, working with them closely in the development of their implementation plans over the next 18 months. And then thirdly, I think one of the major issues is to ensure that federal agencies have the resources they need to make this significant change. And so we're asking Congress to take a look at these issues to make sure that there's adequate investment with federal agencies to undertake this work moving forward. And then I think the other question raised was, how does this exemption process work? So real briefly, I'll say that the Paperwork Reduction Act governs how the federal government collects data. Okay? So anytime an agency wants to make a change to its data collection or asking for new data, it has to submit a form, right, to OMB. And then OMB looks at it and says, well, what's the burden? What's the benefit? And makes a determination. We would like clarity from OMB if their existing process will be the same moving forward for this issue, or will it change? But there's also a public comment period, if that should occur, for folks to write in as well. And we will do our due diligence to make sure that that information gets out to you when that happens. Com?
Thanks, Akil. Next question. How can we effectively counter agencies using burden and confidentiality excuses to avoid collecting and reporting disaggregated data, which only perpetuates structural inequities? Given the availability of statistical solutions for privacy and small numbers, samples, in surveys and other data, why is there no detailed guidance on statistical and technical solutions to protect privacy and still report the data? I'll open that to all the panelists. Who wants to take it on?
Sorry, I had trouble coming off. I'll take a shot at the benefit burden analysis, and I think we'll focus internally on developing additional information for the community on what this process looks like moving forward. I think one of the things that the agency figures out is, what is the cost here? What is the cost for making changes to the form? What is the cost for outreach? What is this going to mean for changes to paper and electronic? And then determining, well, what is going to be the benefit? We've been trying to think about this for a while, and I'll just say this as we're trying to think through kind of the messaging around this too. At the end of the day, I think the issue is life and death for our community. And if we don't have this information and we are not seen, we are not invested in. And folks brought some data to our attention about issues for the NHPI community, for example, and other populations during COVID, and the high number of deaths compared to the national average. For many of our communities, we see disparities in educational attainment. We see disparities in poverty. We see disparities in housing. So to me, the benefit is substantially outweighs the burden. And I think these are issues that we have to raise when agencies are going to be asking for exemptions and say, look, there's two parts to this, and we want to make sure you really kind of understand that. So I think those are some of the major things that we're trying to push for. On the privacy side, we understand some of the limitations in what we call the N size. If the sample size is too small, is there a privacy issue, right? If we say, look, there is one Vietnamese person in this town, and if we were to say, well, oh, that's Quinn, we know her, right? We want to make sure that we are being protective. We understand the federal agency perspective on that. But I think there are other ways in which we can at least collect the data and then have conversations later about whether we don't disclose it or whether we pool information across years to be able to have some sort of insight into a community versus just bearing the information altogether. So I think there are a few options for us moving forward that we need to be advocating and articulating.
Thanks, Akil. And I'll add one quick thing. I mean, I think federally, agencies have consistently used the burden as an excuse for not implementing pretty much like a broad range of issues, not just data. And so we'll consistently hit that barrier. And I think, I think Akio hit the nail on the head when he said that, we have to make the case. It's not just making the case about why our communities are important, but also looking at ways we can circumvent and force agencies to actually take action without, even in instances where they may not be the most receptive to some of the actions that we're trying to get them to take. And the last thing to just add about sample size is, for small populations like the Union into Montagnard communities, we'll never get data on them if we continue to harp on sample size and privacy protections as the primary response to N size. And I think it's incumbent not on communities, but incumbent on the federal government to figure out how to do better reporting so that we can accurately see what those communities are experiencing and get accurate data for them. So I think really it's a conversation of, how should the federal government be reporting out on these populations rather than what methods do we think the communities recommend for reporting out on those communities. Last question, since we're running out of time, is really just, how someone's curious about how the current national focus on DMI or data modernization is affected by SPD 15. So I'll open that up for all the panelists. I'll say on SEARAC's end, we have not worked too much on data modernization, unfortunately. I think as a small nonprofit organization that we have limited capacity in terms of what we work on. But we welcome any input that you might have about how data modernization may be impacted by SPD 15. We'd love to hear your thoughts. So feel free to reach out to us and probably to AAPI Data and CACF as well about the topic and the issue at hand. Unfortunately, we don't have time for any more questions. Thank you so much for being part of this. What we'll do is we'll send out a recap email, and we're also with the recording, with the PowerPoints. We'll also, ask the remaining questions to the panelists by email. And you're welcome to contact us directly. Our emails are listed here. I think lastly, we're just going to do one last poll for folks who are still with us before we close out. So Foon, if you can go ahead and just launch it. So how are you feeling about the SPD 15 revisions? And we'll just give it 30 seconds. Okay, Foon? Well, it seems like the majority of folks here are excited. I think, on our end at SEARAC, while there are gaps, this is a historic moment for our communities. It's a historic victory for the AA and HPI communities. And I think, we should see it as such and figure out how we can best work together to make sure that all our communities' data are being properly collected, maintained, and reported on. So thank you all so much again for being part of this. Feel free to follow us on Facebook, on Instagram, to join our newsletters for SEARAC, AAPI Data, and CACF. And we'll send out a recap early next week. Thank you all so much. Take care.